inflammation in regards to perio. So, basic inflammation, inflammatory response. So, tissue damage triggers a local increase in blood flow and capillary permeability. So, and then permeable capillaries allow an influx of fluid. So first blood constricts. Actually, I'm not sure. But basically permeable capillaries allow an influx of fluid or exudate and cells into the tissue. And then phagocytes migrate to the site of inflammation, known as chemotaxis. And then phagocytes destroy the bacteria, known as phagocytosis. Mast cells in connective tissue release chemicals to dilate and increase vascularity, swelling, pain, and heat. Leukocytes arrive next, leave the vessels enter tissue, and leukocytes phagocytize pathogens. So, here's a little chart talking about that more. Tissue invasion by bacteria. When you get bacteria in your tissue, it results in injury to the body, and the body reacts by the body's inflammatory response. In the inflammatory response, you have increased blood flow, delivery to the body's defensive cells and plasma to the invasion site, and then you have leukocytes and plasma proteins that leak from the blood vessel into the tissue. Leukocytes fight the invading bacteria, and some tissue destruction occurs in the surrounding area of the infection, and that is a side effect of the body's inflammatory response. So the body is not trying to damage any more tissue already, but in order to have an inflammatory response, some tissue damage occurs. Inflammatory mediators. Inflammatory mediators activate the body's inflammatory response. Leukocytes phagocytize invaders, and they release inflammatory mediators. Major players in periodontitis are cytokines, prostaglandins, and MMPs, or matrix metalloproteinases. Cytokines, secreted by leukocytes, protein communicators, regulate behavior of immune cells. Chemokines is a type of cytokine, and that attracts additional immune cells to the injury or affected area. So what do cytokines do? They communicate with proteins and they regulate immune cells. You have two stages of inflammation, and we know this from oral path, but acute inflammation and chronic. Acute inflammation, quick, short duration. It is achieved by an increase in the movement of plasma and leukocytes from the blood to the injured tissues. What are the 5 cardinal signs of acute inflammation? Heat, redness, swelling, pain, loss of function. Heat, redness, swelling, pain, loss of function. Acute inflammatory response. Blood vessels increase permeability, releasing plasma proteins and leukocytes. What cell is the first to arrive in a normal situation of inflammation? PMNs or neutrophils. PMNs or neutrophils are the first cell to arrive, and they're short-lived. Why are they short-lived? Because they die during phagocytosis. What helper cell, though, in some situations come before neutrophils do? Mast cells. Mast cells come in situation of infection. Not inflammatory, but infection. So, PMNs and neutrophils, they release cytokines, which are interleukins and tumor necrosis factor, TNF. Inflammatory cytokines tell the liver to produce C-reactive protein, which is an acute phase protein. If the body is successful in eliminating the microorganisms, inflammation will stop and healing will start to begin. What are some diseases that will show a high amount of blood level of CRP, C-reactive protein? Periodontitis, diabetes, hypertension, cardiovascular disease. So, how does something turn from acute inflammation to chronic inflammation? If acute inflammation is not effective in controlling the invading microorganisms, the inflammatory response then becomes chronic. Usually, the acute infection lasts 2 weeks or longer to become chronic. Chronic inflammation. Chronic is long-lived, out of control, continues for more than a few weeks. It can destroy healthy tissue, causing more damage than the original inflammation. In periodontitis, there are no classic sign or symptoms go unnoticed by the patient. Okay, super important because it's in red, so it must be super important. Chronic inflammation. When inflammation becomes chronic, the inflammatory response can become so intense that it does permanent damage to body tissues. We know this is true because in periodontitis, which is chronic inflammation, you have permanent damage happening to the periodontium, or the bone. That tissue never comes back. It's permanently damaged. Why does chronic inflammation occur? Well, the body is unable to rid itself of whatever organism is causing the problem. The invading microorganisms are persistent and they stimulate an exaggerated immune response. So what's the process of chronic inflammation? Well, you have an accumulation of macrophages. The macrophages engulf and digest microorganisms. Leukocytes release inflammatory mediators that help perpetuate the inflammatory response. And again, this is in red, super important, tissue damage is the hallmark of chronic inflammation. So, what is the hallmark sign of chronic inflammation when you have tissue damage? Examples of chronic inflammation. You can have rheumatoid arthritis, diabetes, asthma, atherosclerosis, gingivitis, and periodontitis. Periods of remission and exacerbation. Remission. Clinical signs and symptoms partially or completely disappear. Exacerbation. Symptoms recur in all their severity, or the disease is active. And then you have quiescence, or whatever, quiescence is temporary inaction. So here's another example of cells and mediators in chronic inflammation. You can see the picture. So interleukin 1. Interleukin 1 increases vascular permeability. It activates B and T cells. It's pyrogenic, which means it causes fevers. It synthesizes C-reactive protein in the liver. What other things create C-reactive protein? PMNs release cytokines that inform the liver to make C-reactive proteins. So interleukin 1 and PMNs can cause C-reactive proteins to be made. Interleukin 6. Interleukin 6 increases vascular permeability. It activates B and T cells again. It's also pyrogenic. And it synthesizes C-reactive protein in the liver and increases immunoglobulin synthesis. Leukotrienes and prostaglandins. What are leukotrienes? They help leukocytes push their way from the blood vessel to connective tissue. What are prostaglandins? Prostaglandins create vasodilation, fever, and pain. TNF-alpha. TNF increases vascular permeability, activates T and B cells. It has to do with chemotaxis and pyrogenics. It also synthesizes C-reactive protein. It creates a loss of appetite and an increased heart rate. Alright, so now let's talk about the host's immune response. So, the person's immune response. Host response to periodontal pathogens. The presence of periodontal pathogens alone is insufficient to cause tissue destruction. So, just having a pathogen in your mouth by itself is not enough to cause destruction of tissue that we see in periodontitis. It's the body's response to the pathogen that causes the destruction. So, does the bacteria in your mouth alone cause destruction? No. Does the way your body reacts to the bacteria cause destruction? Yes. Host response. A particular body's response to pathogens. The prime purpose of the immune system is to defend the life of the individual. The body's defenses are employed to save the life of the host, not to preserve the tooth or supporting periodontal tissues. That's important to remember. The goal of the inflammation response or immune system response is to save the person as a whole, not necessarily whatever tissue is being destroyed. Biochemical mediators, the middlemen. Biochemical mediators are sent by immune cells to activate the inflammatory response. Inflammatory mediators that are important in perio are cytokines, prostaglandins, and MMPs, like we talked about earlier. Cytokines. These are released by host immune cells. They influence the behavior of other cells. They signal to the immune system to send more phagocytes. They are produced by neutrophils, macrophages, B cells, epithelial cells, fibroblasts, and osteoblasts. They are produced in response to tissue injury. In periodontal disease, cytokines include interleukin-1, interleukin-6, interleukin-8, and TNF-alpha. Function of cytokines. What do? Cytokines recruit cells. What are the cells they recruit? Neutrophils and macrophages. They also increase permeability, which increases movement of immune cells and complement factors. What's the number one important red bolded thing that cytokines do? They initiate tissue destruction and bone loss in chronic infections. So we talked about a pathogen in your mouth isn't going to cause damage until your body reacts to it. But when your body reacts to it, what is released that causes or initiates the tissue destruction? Cytokines. Prostaglandins. Powerful inflammatory mediators derived from fatty acids. You have a series of them, D, E, F, G, H, I. Most cells can produce prostaglandins. Prostaglandins are a major source. A major source is a macrophage. Secondary is PMNs and gingival fibroblasts. Prostaglandin E is bolded because it's important in the role of periodontal destruction. So what do prostaglandins do? They increase permeability and dilation of blood vessels, leading to redness and edema. They trigger osteoclasts, bone-consuming cells, to destroy the bone. They promote overproduction of destructive MMP enzymes. Bolded in red, most important thing of prostaglandins. They initiate most of the alveolar bone destruction in periodontitis. So cytokines was tissue destruction. Prostaglandins are alveolar bone destruction. MMPs. MMPs are produced by various cells in the body. In health, MMPs facilitate normal turnover of periodontal connective tissue. In disease, enzymes act together to break down the connective tissue of the matrix. MMPs, chronic bacterial infection. MMPs are released in an attempt to kill invading bacteria. The overproduction results in a breakdown of connective tissue of the periodontium. High levels of MMPs result in extensive collagen destruction. Without collagen, the tissues of the gingiva, periodontal ligament, and supporting alveolar bone break down. Gingival recession, pocket formation, and tooth mobility result from MMPs. Okay, so let's now be very specific and talk about immune response in periodontitis. So, what are the phases of microscopic changes of periodontitis? You have accumulation of bacteria, which is the initial lesion, right? And then you have early gingivitis, which is the early lesion, established gingivitis, which is an established lesion, and then periodontitis, which is an advanced lesion. So, let's talk about the initial lesion, which again, initial lesion was bacterial accumulation. So bacteria starts to colonize near gingival margin. It initiates the host response, because again, anytime there's a pathogen in our mouth, it's fine in there until the body responds to it, right? And then PMNs or neutrophils pass from the bloodstream into the gingival connective tissue. PMNs or neutrophils release cytokines, destroying connective tissue, allowing PMNs to move more quickly through the tissue. And then PMNs migrate into the sulcus, phagocytizing bacteria. In the initial lesion, gingiva still looks healthy. It begins in 2 to 4 days of biofilm accumulation. If pathogens are not controlled, the next step would be early gingivitis, which we're going to talk about now. Early gingivitis, which is the early lesion. Bacteria is present and penetrates the connective tissue. More PMNs are attracted to the site and release cytokines, which cause destruction of connective tissue. Macrophages are recruited to the connective tissue, and they also release cytokines, prostaglandins E2, and MMPs. Cytokines are released by junctional epithelial cells. PMNs, neutrophils, destroy healthy tissue. PMNs create wall of cells. The sulcular tissue is most affected. Now, in early gingivitis, the clinical signs are swelling and redness. And it takes about 4 to 7 days of biofilm accumulation for this to occur. But, however, early gingivitis can still be reversible. But if it's not reversed, it goes on to established gingivitis, which is now an established lesion. Plaque biofilm extends subgingival, disrupts attachment of coronal, most portion of the junctional epithelium. Macrophages and lymphocytes are most numerous in the connective tissue. PMNs continue to fight bacteria in the sulcus. Host cells produce more toxic chemicals, cytokines, prostaglandin E2s, and MMPs. So this is when plaque has gone subgingival. Let's see. What else should we know about this? It takes about 21 days of biofilm accumulation, and in established gingivitis, all gingivitis features can be clinically observed. You know it's gingivitis. And if that does not reverse, it becomes periodontitis, which cannot be reversed. Periodontitis is an advanced lesion. Plaque biofilm grows along the root surface. An immune response becomes chronic. Intense inflammation begins to harm the periodontium. Cytokines destroy connective tissue and PDL fibers. Cytokines, prostaglandin E2s, MMPs destroy connective tissue and bone. And you have high levels of MMPs. Periodontitis is chronic inflammation. It's out of control response, and it's not reversible. Mechanism of alveolar bone destruction. How does alveolar bone breakdown happen? Macrophages produce cytokines, interleukin-1s, TNF, PGE2s, and MMPs. These mediators stimulate fibroblasts to create more PGE2s and MMPs. Mediators from the macrophages and fibroblasts destroy connective tissue. So, final thoughts about this. The periodontium needs to be healthy, and in order for it to be healthy, the bacterial infection must be controlled so it does not continue to become a chronic infection, causing an exaggerated host immune response. Periodontal disease has a big link to systemic disease. Men in their 30s with inflamed gingiva caused by severe periodontal disease were 3 times more likely to have erectile dysfunction, and chronic periodontitis and systemic vascular diseases like ED and coronary heart diseases are also linked. So there you go.